I'm frequently asked, how do we know whether a person needs a filling or a crown? A lot of it has to do with how much of the tooth is still remaining, how much good solid tooth. And, the camera and the x-rays are so helpful because we can show people what's going on. So especially older fillings like silver fillings, they had to be locked in place, so they're bigger on the inside. So whenever you're sitting there looking at the filling, you're always looking at the smallest part. And we have the camera, so some people are interested and some people aren't. Don't ever show me that. But we'll look at it, and once we take out the filling, they're just surprised. There's not a lot left. Or could be the other way. But I never know quite how much flare there is in there. So once we take it out, then we decide. And sometimes when we treatment plan, I'll say, hey, if it's going to be a crown, we want you to know what that fee would be, but it might be a multi-surface filling. This is what that fee would be. And occasionally people will be very frank with us and say, boy, I just can hardly afford a crown right now. So I say, well, let's not let that stop you. Let's put in a really big filling. Now we know it's not going to last as long as we'd like it to, because it's just not made to endure those type of forces. But we could put in the filling and then come back in a couple of years and put in a crown. The thing to remember though is we got to come back to it, because fillings aren't see-through on an x-ray, so I won't be able to see when decay's creeping in again.